I believe that every woman should be a strong participant in her health care, and I will do my best to make sure that I share as much knowledge as possible to make you a one person who can effectively contend for your health care. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi, and today I will be covering some of the very important things that a woman can encounter right after she's given birth to her baby. It's important for me to state here that what I will be addressing is for women who give birth vaginally, and I will have another video for women who give birth via cesarean section. But make sure that if you haven't done so already, that you hit the subscribe button and turn on your notification bell so that you are made aware of every time I upload a video. Now, in the immediate postpartum period, there are a few things that a woman needs to be very concerned with. The first one is the very increased risk of losing blood. After a woman gives birth, she will have a flow that resembles a very heavy menstrual flow. And this is okay because your body is trying to get rid of all the extra tissue that you carried along with you in your uterus as you grew your baby. But once your baby is born, all of that has to be pushed out. However, it's very important to make sure that you are not over bleeding. If you are wearing a pad and you soak that pad within 1 hour of putting it on, and by soak, I mean covered from front to back, then that's not normal. You want to let your doctor or your nurse know so that they can check you to make sure that everything is okay. Keep in mind that with bleeding, you don't want to pass a lot of blood clots. It's normal to have little blood clots here and there, but if you ever pass a blood clot that is larger than the width or the size of a golf ball, or maybe the size of this circle here, that's not normal. You want to let your nurse or your doctor know so that they can evaluate to make sure that something is not going on, preventing your body from having a very toned uterus. Along with the risk of increased bleeding is the chance of infection. Infection is very risky during this period because, for one, a woman is open because she just gave birth. And if you had to get like a episiotomy or some other surgical intervention to make sure that you delivered safely, then that open wound, it creates an opportunity for infection to come into your body. It is very important in the immediate postpartum period up to 6 weeks after giving birth that you avoid taking any sort of soaking baths. When you soak yourself, imagine that, your body is trying to get rid of the excess blood that it carried while it grew a baby. And on top of that, if you had an episiotomy or any sort of tears that happened while you were giving birth, that's an open wound. By sitting down in a tub and having your body interact with this water or the soap or things like that, you give bacteria and other nasty pathogens the opportunity to go into the vaginal area where they can cause a lot of damage, and you do not want to deal with that. So make sure that you are standing and taking your shower so that you rinse all of that off your body. It's also important that when you change your pad, that you wipe from the front of the vaginal area to the back towards the anus. You don't want to wipe from back to front, because if you do that, imagine bacteria that is normally okay in the anal area now being brought forward into the vaginal area. That also increases the risk for infection. Make sure you are showering daily just to decrease the amount of bacteria and other offensive things that can build up on the body. Keep in mind that you will continue to have contractions even after you've given birth to your baby. Your body is going to need some time, or maybe a couple of weeks, to get that uterus back to the size that it was before you gave birth. If you are breastfeeding your baby, there's a chance that these contractions will hurt a lot more than for moms who choose not to breastfeed. If the pain is so bad that you cannot deal with it, let your nurse know, let your doctor know. If you live in a country where you have to bring your own medication to the hospital, keep this in mind and get something that can help you relieve the pain. Another thing that a lot of women will deal with after they've given birth to their baby vaginally is constipation. Remember that as you are pushing out your baby, your body pushes everything out of the way to make enough room for your baby to be born. Well, some of the things that get pushed out of the way are your intestines too. So that flattening along with the hormonal changes in your body and the fact that a lot of times you are sitting on your bottom for long periods, it just causes the movement in your intestine not to be as effective as it should be, and that results in constipation. To avoid constipation, make sure that you stay very well hydrated. Make sure you eat a lot of vegetables that are rich in fiber. You can also eat naturally fibrous food like oatmeal to help your body move these bowels. Also, make sure you get up and move around. I know you just had a baby and that you are sore, but if you get up and move around, you generally encourage your intestines to get things moving along so that your body does not have such a hard time having a bowel movement. If you are dealing with hemorrhoids, make sure you let your nurse or your doctor know, because a lot of women who deal with hemorrhoids don't want to push out a very hard bowel movement for good reason, because the hemorrhoid can bleed and that can add more pain to an already sore bottom area. You can also use medications such as docusate sodium to help loosen and soften the bowel movement to make it easier for you to pass it. Along with constipation and hemorrhoids, another thing that a lot of women frequently deal with in the postpartum period is vaginal swelling. And that is because your tissue, your body goes through a lot of trauma just to bring your baby into this world. Now, some things that you can do to deal with that vaginal swelling include applying either a cool or a warm compress to your bottom area. If you're going to do a cool compress, make sure you don't apply it for longer than 20 minutes. If you do a warm compress, make sure that you are comfortable with the heat and that you don't further cause harm to your tissue because you use extremely hot water. Now, a lot of women will use something known as a sitz bath. And a sitz bath is nothing more than taking a little tub and filling it up with warm water and sitting just your bottom in this. This is very different from taking a full bath where you immerse yourself in water. A sitz bath helps your body to get all this warmth going in there to help wipe that tissue, that area, ease the swelling, calm it down, and help you to begin the healing process. Now, once you are done with a sitz bath, make sure you don't wipe, especially if you have stitches. If you have stitches and you wipe, you can traumatize the tissue by pulling on the stitch. Make sure that you pat the skin dry before you put on a new pad and your underwear. Another thing that women can use is known as witch hazel pads. Now, I don't have the pad here, but I want to show you a bottle that says witch hazel. This is the facial ointment, but the witch hazel is also available in a pad form that can be applied directly to your bottom area, and it can help to relieve both the swelling from the hemorrhoids and the swelling from the vaginal trauma. Okay? Make sure that if you deal with any pain or swelling or hot spots in your leg or in your thighs, that you let your doctor or your nurse know. Any sort of localized pain is not something that you want to deal with in the postpartum period. And because a woman is at increased risk for having little blood clots, we don't need for moms to be dealing with that kind of pain and not report it to somebody. So if you have like a hot area in like the back of your legs or in any position in your thigh, make sure your doctor or your nurse knows about it. It's also important for you to do a little exercise known as Kegel exercise. Now, Kegel exercise is nothing more than tightening the muscles of your pelvic area. Some people don't know what this muscle is, so I'm going to do my best to describe it here. Do you know that sensation that you get when you have to go to the bathroom and urinate right away, but you know that you don't have access to a bathroom? That muscle that you squeeze to make sure you don't pee on yourself, that's the same muscle that you will squeeze here to begin to strengthen your pelvic muscle and your bladder muscle. By squeezing this a few times every hour, just squeeze it, hold it for about 10 to 30 seconds and release it. And do this 1 to 2 sets every hour. You will begin to tone your bladder and your pelvic muscles that relaxed while you were pregnant. This one should go without saying, but make sure you do not participate in any sexual activity for the first 6 weeks after giving birth. When you give birth, your body needs time to get back to normal. If you had stitches, it really is not encouraged for you to engage in any sort of sexual activity at all. Remember that a lot of women can and have seen a cycle where they release an egg before they even go back for their 6 weeks checkup. If you participate in any sexual activity, it is very possible for you to be pregnant again before your body even fully recovers from the birth of this child. And doing so while while every child is a blessing and a welcomed gift, it also does not give you enough time to recover and replenish all the nutrients and vital strength that your body gave forth to nurture the body of the baby you just gave birth to. So give yourself a little bit of pelvic rest and do not participate in any sexual activity. It is also important for you to rest as much as possible. I know that it's not possible for a lot of moms because you are anxious, you want to do for your baby, you want to bond with your baby. But remember that your body has not just carried a baby for 9 months, but you've also gone through the trauma of giving birth. Give yourself some time to recover. Take a deep breath. Even if you don't have the help necessary, make sure that you take some time to rest and recuperate. The task there, the washing the dishes, the cleaning the house, the taking care of the other children will be there whether or not you do it. Make sure you take some time and do some self-care. When you take care of yourself, you are better able to take care of your baby. Make sure you sleep when your baby sleeps. That's typically the best time to sleep. And you know that because babies eat on a very weird schedule, it's not going to be possible for you to take long, drawn-out sleep. So if baby lays down to catch a little snooze, lay down next to your child and get some rest. It is very important for you to do so. Now, if you deal with any feelings of depression, or you feel sad, or you're just not interested in any activity that you normally would find yourself interested in, or you don't want to bond with your baby, make sure you let your doctor or your nurse or a trusted family member know. These are not normal feelings or emotions and should be addressed if they are worse than is typical in the immediate postpartum period. It's okay for you to feel a little hesitant or feel, because your hormones are going up and down, doing all sorts of different things right after you've given birth to your baby. And while your body relearns its natural processes outside of pregnancy, it may take some time for you to get back to the normal flow of activities that you've had before. But it is not normal for depression or feeling sad to keep you from being able to do anything at all. This is what you want to report to your provider or your family member so that if help is possible, it can be provided for you in a timely manner. If you have found value in the content of this video, make sure you hit the subscribe button and turn on your notification bell. Come along with me as we build this community of empowered learners across the globe. I believe that every woman should be a strong participant in her health care, and I will do my best to make sure that I share as much knowledge as possible to make you one person who can effectively contend for your health care. Until the next time, congratulations. I wish you the best. Be blessed.